Hi, Doc. How's it going?
Good. How are you?
Good. Everybody, this is Dr. Jacob McClintock. Could you tell them a little about yourself, sir?
Yes. I'm a family medicine boarded physician. I currently work only in the ER and moderate volume ERs in small towns. I did my med school training at UAMS in Little Rock, Arkansas. Did my residency in Lubbock, Texas in family medicine. And then since then, I've been doing locum tenens ER work for the past 8 years. So
Nice.
yeah.
So how did you find Kyusho?
When I was young, actually my parents had a Ishinri karate dojo, and they came across your videos in the mid 90s, and a few of them. We had the first, I think, your Budo videos, video 1 and video 2. And since then I've always been very interested, but we weren't able to get the techniques to work right away. So we abandoned them, and then I got busy with school and never really, pursued it again. Until a few months ago when my child was looking at videos on YouTube, and we came across your knockout video where you use the Mawashi Uke knockout, where you hit the forehead and you kind of brace the low back using the iron palm technique. And he said, "Oh, Dad, does that work?" And I said, "No, it's fake. Let me show you. You come try it on me, and I'll show you how fake it is." Well, he did it, and I saw a white flash, and I woke up on my back, went out stone cold, and I woke up and I was very excited that this worked, and I was excited to pursue this more, and so I immediately subscribed to your video service, to your website, and I've been learning it as fast as I can possibly learn it.
Yeah, sometimes it takes a kid, doesn't it?
Yep.
That's amazing. Yeah, we've been battling, a lot of people battled it, myself included. We battled it early on. And I think that's because we might have been using the wrong paradigm. We were using the old pressure point system of acupuncture or acupressure, when actually if we just looked deeper into the nerves and the blood vessels, that we would have gotten much better response much quicker.
Yeah. As a physician, that approach is much more palatable to me, especially since I can look up the nerves, look up what exactly it's getting pressed against and the technique, and, what vessels being compressed, especially with the DIMMAC. It's real exciting, but it's much more, something that I can pursue with my knowledge base rather than the traditional Chinese medicine.
Right. Yeah, it's a little more quantifiable too. I mean, you can get measured results. You can actually measure them on many medical instruments, and then you can duplicate it easier. I think the pressure points, the issue with the pressure points was that I believe that it's on fascia. And while it works to a certain degree, and it has certain limitations as well, but working more with the neurological system, muscle spindle cells, Golgi tendon organs, things of that nature, and, just raw nerve is the best, I think. It's become much easier for people to learn. And I've seen the learning curve just diminish. I mean, it's what we took 5 to 10 years, people picking up in less than a year.
Really?
Yeah, it's amazing.
Well, I actually worked with some of these techniques with my brother, I guess a couple of weeks ago now, and they work like a charm, especially the vessel constriction techniques, using the single bladed grass hand. It's just, it works like magic.
Yeah. Now, you were telling me you're also studying now BJJ, or Brazilian Jiu-Jitsu.
Yes.
You've put it a little bit into that as well.
A lot, actually. it's kind of my go-to technique. Everyone has sort of a game that they play against their partner, and they have certain kind of pathways of techniques that they tend to use over and over. And I've simply applied it to my strategy as far as compressing the carotid artery on one side and then compressing the other side, the internal and external carotid on the right below the ear. And just the very first move from your Rokushu kata, and I get a tap out every time. Just immediately.
Nice. Yeah. Have you been able to utilize other things than the carotid?
Oh yeah. A lot of it is more of a compression. It's not, the hitting, like when I go to the liver attacks, or when I go into the subclavian artery, techniques. But, that single blade of grass hand is so versatile, and, I use it quite a bit in my rolling, especially when I get the back. If I can get both sides and use that, the cloud hand technique that you're showing, it just works like magic. And a lot of times, my partner has to lay on their back and, wait for the dizziness to go away before they can continue.
Nice. Did they know what you're doing?
No, I don't talk about that. It's funny. When they ask me anything, what are you doing or what did you do? I'll always say, I don't know. And I give them this goofy story that, I grew up on a farm and I had a big sheepdog, and I used to wrestle with my sheepdog, and sometimes I would do this to the sheepdog and it worked. And,
that's a good one. I never heard that before.
Yeah. It doesn't win any friends, but, a lot of times in that setting, the guys I'm going with against have big neck tattoos, and they're trying to look as mean, as scary, and be as intimidating as they can. And I try the opposite approach. And, sometimes it can be a hostile environment. And I don't feel like I, as a traditional martial artist, fit too well. But it's a good way to hone your skills, so to speak.
Sure. So, do you still study the Ishin-ryu?
I do. I practice it pretty extensively every day. And my son and I are going through that as well. It's funny. I've switched to your version of San Shin.
Okay. That's the Weichi version, by the way, folks.
Yeah, the Weichi, and your energy work with it, and all your techniques are just so amazing. I can't really go back to the closed fist from the open. So, thank you for that.
Yeah, well, it's in the Bubishi. I'm just playing with them myself. So, the revelation was great, and we've been able to affect the Kyusho even better because these hands, penetrate deeper. Much better than a fist or just our old conventional shuto or other type of methods we used that we were taught in karate. But when you start really focusing on these specific hands and their specific torques or rotations, it brought a lot to the table.
Yeah. It's funny, speaking of the jiu-jitsu partners getting dizzy, one of the things that you taught in the Rokushu kata video series was the fourth revival.
Right.
And that's where you raise the legs up. When the blood pressure drops, you raise the legs up, and the blood pressure will increase in the core of the body and the brain, and they feel better. I had a patient about a month ago now that came in hypotensive after bleeding from a arteriovenous shunt in their arm. And they were a dialysis patient, and they had developed an aneurysm at the needle insertion site that then ruptured when he was sleeping. And he woke up, was bleeding, and wasn't able to very effectively apply pressure to it. And I think all he did was scream and look at it and call 911. But when the EMS crew got there, he was unconscious. Of course, they applied pressure, stopped the bleeding, but he was very hypotensive and very tachycardic when they brought him to me in the ER. Of course, he was covered in blood, had clearly bled from that site and was hypotensive because there's not enough blood volume. Well, as I immediately put a central line in for IV access while they're trying to get the rapid infuser going to get warmed crystalloid, which is non-blood blood products, into his system, as we're waiting for the the blood products to come from the lab to give him as well. And in that interim, when they couldn't get the machine to work correctly, I noticed on the monitor his pressure was going even further down, but his heart rate went from high to normal, which is a bad sign in hypovolemic shock. And then it started to get or bradycardic further and further down into the 40s. And that's usually a sign that he's about to code. He's about to go into cardiac arrest. So I said, well, let's go ahead and just try the fourth revival. It's not going to hurt anything. So I lifted his legs up, and his heart rate came back up to normal, came back up to a little bit tacky, and he actually woke up.
Wow, nice.
And shortly afterwards, he got the fluids and blood products to resuscitate him. But that revival technique prevented him from going into cardiac arrest. And I'd like you to know that that was because of your efforts of putting that revival into video form that then saved his life.
Wow. Thanks for that comment. That's great that you were able to help him. And that's awesome. It's just amazing. It blows my mind what this the Kyusho study has done. For our people that don't understand, or the people watching that don't have really a medical background or an idea of it, could you tell just briefly and simply, if you can, what hypovolemic shock is? Because it's mentioned in all of the notes from Mabuni, from Funakoshi, from Sokin, and on. So could you explain it just a little?
Sure. So hypovolemic shock is when your blood volume is too low, usually from an arterial bleed where you bleed out from your system quickly, and the blood volume is too low to keep the pressure within a reasonable limit or within a physiologic limit to allow the heart to function correctly and the brain to function correctly. And so the treatment is more fluids, more blood to replenish the system.
Nice. Thank you. Because, again, we read these in the notes, and people were reading the notes of people that wrote about the pressure points as example, and how the chi backs up and the fire melts the metal and all this, and it added definite confusion to the Kyusho art. It also developed skepticism. A lot of people just don't believe it now because the art was poisoned, I think. But when you read these notes, I mean, people can't encrypt these either. Okay, now if you understand medical terminology or you do research, that's all I did. I just did research. And I found the answers, and I found even deeper keys within the Bubishi because of it, and the hands and whatnot. So thank you for that explanation. That's great.
Sure.
So where do you see your Kyusho going?
What's that?
Where do you see your Kyusho going?
Oh, I would really like to apply it to Brazilian Jiu-Jitsu in some way. And you have a lot of grappling videos, and I've been watching those pretty extensively too, and you've got quite a bit covered. I don't really know where I could expand on that because it's extensive, but I would like to apply it to the quote unquote modern martial art that's developed in America and around the world. It sort of bridged the old with the new because I really do feel that the new is lacking quite a bit. even though it is supremely effective in the ring, that doesn't mean it can't be improved with some of these amazing strategies and targets that you've distilled from these old arts.
Yeah. I remember seeing an old MMA fight. I think it was maybe even back in the UFC days, where Matt Hughes and one of the Gracie brothers were going at it, and Matt Hughes got the Gracie brother in a side arm lock. And I thought that elbow was just going to pop. But, he's probably been doing that since age 3, so his elbow goes there anyway. So it's frustrating for Hughes. But at the same time, if he had applied a little rub on that Golgi, I think it would have gone.
Yeah.
So, I don't know if they want to get to that level of abuse in the MMA or the UFC, but there is a possibility. And when you look at those old films, or the knockout films, you can see the Kyusho happening all the time.
Well, pretty much every knockout that I see when I watch UFC, it's on a facial nerve, and it's at the proper angle direction. And a lot of times, they're lifting that back foot up off the ground. Which brings me to another interesting question.
Sure.
In your video on Anatomy of a Hook Punch, you discussed the energetics between two same-sex individuals and how to activate the point or to get the energy into the nerve more efficiently, it's important to raise your leg off the ground, your foot off the ground.
Right.
And it seemed like it seemed very woo-woo to me. And my brother and I practiced it. My brother's name is Clancy McClintock, and we practiced it a few weeks ago, and it was amazing. And my brother, the effectiveness was incredible. Almost 10 times more effective when you raise that foot off the ground. And my brother kept saying, this can't be real. This is not real. I don't know how this is working. This can't be real. And I said, it is real. It's working.
Well, if the proof's in the pudding, huh?
Exactly.
Yeah.
Could you maybe explain that to us Westerners a little better? What in the heck is going on there?
Okay. Yeah. Anytime you go off in any kind of energetic, people automatically think woo-woo. But there's the reality to it. Our brain is the electrical battery, our spine the circuit breaker, and our peripheral nerves are the wiring in our home per se. When your brain generates the electricity, it's going to go down through all the muscles to make the muscles work through the motor system and get them acting as you want it. Your conscious mind wants it to. One of the functions is when you're standing, it's going to energize the leg muscles. So they're tense or they have the proper tension to support the body weight. All right. Now, if both people are doing that, okay, you're sending a lot of electrical energy or impulse down into your legs, and there's less available for your hand. Now, this is my speculation. I've never measured this. I don't know how to measure this, and many of the people that I talk to, scientists and doctors, that nobody really understands how to measure this. But if you lift your heel, then the energy that's available on that side at least doubles, because it's not being used to support the body weight. So there's less neurological messaging going into the leg and more available for the hand. Now, that's as near as we can figure it. Now, we saw that being very effective when you were moving, or not moving, but when you're stationary and you're just trying these points out as an experimental thing. But we also found out that even when you're moving, your energy's transitioning, but you have to catch it just right when you're moving. But if you make that conscious effort to lift the heel in particular, then it's going to work much better for you. And another thing, a buddy of mine works out in Ohio. He's a shiatsu practitioner. Mm-hmm. And he's been able to fix a lot of big problems with neurology and issues. So much so that he's got a couple hospitals sending him patients after they're stabilized. And a couple of them were from lightning strikes.
Really?
Yeah, yep. And he said, there was a kid that was struck. There was a couple of adults who struck on the golf course, of course, for the adults. The kid was just out in the yard playing or out in the park playing. But he said that every time that they lift their heel, they survive. It's when they're completely grounded that the incidence of death occurs. Okay, and what happens, or what he thinks happens, is because he's seen holes in the head where the lightning entered, and he's seen holes in the heel where it tried to exit when the heel was up. So what he's thinking, and what makes kind of sense to me too, is the sciatic nerve goes into the foot and the plantar nerve in such a way that that might be our ground. All right. If you lift the heel off the ground, you're not grounded, and the energy is not dropping to the floor. So it sort of coincides with the muscle strength theory, but it's kind of interesting that occurred.
Yeah, it is. It's very interesting, and it definitely lends a little more credit to the chi idea in the study of that, because it's an ancient study. Of course, it was done before, modern science, but that doesn't mean it couldn't be continuously studied and more found out about it.
Well, it should, but I think sometimes people go off on tangents thinking it's an alternate life force that can be enhanced or decreased. And if they thought about it more as neurological messaging. Now, for example, we have an electromagnetic field around our body that can be measured, has been even photographed through Kirlian photography. But if you think about it in electrical terms, if you send electricity or even water through a straight hose, it forms an electromagnetic coil around the outside. Well, couldn't that just be the chi that the ancients were talking about when looked at in a modern idea?
Yeah. Very interesting.
And that would give us even more support for something like kata ascension. Because the rotations of the body in that simplex form, mimic the electromagnetic field. As a matter of fact, if you look at the body structure of the X shape of the arms being out and the legs being out, that's like a crossing of our DNA. So there's many correlations that you could dig into and investigate. And I just hope that future generations can, really get into it a lot deeper. I've got so much time left. I'm still working on it, still trying. But I think the future generations will probably be the ones that uncover it for sure.
Well, I think that the work that you've done has definitely provided them a platform to then do more. It's like you're the giant whose shoulders we're standing on.
Oh, I don't know about that. I'm kind of short, but yeah, I see the new generations, though, especially the younger kids. Some of them are really eager. Us old gumps, we want to learn it, we want to know it, but there's a limitation to what kind of time we want to put into it. Some of these younger kids, they're just going to expand with it and explode with it, and I can already see their skill is far better than what we're going to be.
Yeah.
Yeah, it's exciting, actually.
Yeah, it is. It is.
Yeah. So, well, sir, it's been a pleasure talking to you. I look forward to working with you in the future. I think the Brazilian Jiu-Jitsu tape is something I'm going to very definitely go for and work with. And as a matter of fact, I've already started on it. Several months ago, I started on it. And being older and a little less flexible, I'm not as good as I used to be at grappling, so it might take a little while, but we'll get there.
All right. Well, I'm down for whatever I can contribute, and can't wait.
Well, I appreciate the talk today.
Yes, sir. Thank you very much.
Take care.